Hi doctors, welcome to the last episode of our A to Z series Season 1, where in each episode alphabetically we discussed one of the most repeated previous year topics of INI-CET, NEET PG and FMGE, and our today's episode is episode Z, where Z stands for Zollinger-Ellison syndrome. So let's begin with solving a MCQ. All of the following are features of Zollinger-Ellison syndrome except option A, intractable peptic ulcers, option B, severe diarrhea, option C, arise from beta cell tumors of the pancreas, or option D, very high acid output. So which option do you think is the correct one? Well, yes, option C, arise from beta cell tumors of the pancreas is the correct option. So moving ahead, let's talk about Zollinger-Ellison syndrome is a rare condition characterized by the presence of gastrin-secreting tumors known as gastrinomas, typically found in the pancreas or duodenum. These tumors lead to excessive production of gastrin, a hormone that stimulates the release of gastric acid in the stomach. The increased gastric acid secretion results in the development of peptic ulcers in the stomach, duodenum, and sometimes other part of the gastrointestinal tract. Here are some key points about Zollinger-Ellison syndrome. First, gastrinomas. Zollinger-Ellison syndrome is primarily caused by the presence of gastrinomas, which are usually small, slow-growing neuroendocrine tumors. Gastrinomas are commonly found in the pancreas around 70 to 80% of cases, but can also occur in other locations such as duodenum, lymph nodes, or even the liver. Second, excessive gastrin production. Gastrinomas secrete abnormally high levels of gastrin, which leads to increased production of gastric acid. Gastrin stimulates the parietal cells in the stomach to produce more acid, resulting in hyperacidity. Third, peptic ulcers. The excessive gastric ulcer secretion in Zollinger-Ellison syndrome causes the development of multiple and recurrent peptic ulcers. These ulcers can occur in the stomach, duodenum, and less commonly in other parts of the gastrointestinal tract. The ulcers tend to be resistant to standard ulcer treatments. Fourth, symptoms. Patients with Zollinger-Ellison syndrome often experience abdominal pain, burning sensation, heartburn, nausea, and vomiting. The symptoms can be severe and persistent, sometimes leading to complications such as gastrointestinal bleeding, perforation, or obstruction. Fifth, association with multiple endocrine neoplasia type 1, MEN1. Zollinger-Ellison syndrome is often associated with a genetic disorder called multiple endocrine neoplasia type 1. MEN is characterized by the development of tumors in various endocrine glands including the parathyroid gland and pituitary gland, in addition to the pancreas. Diagnosis of Zollinger-Ellison syndrome involves measuring fasting serum gastrin levels, performing gastric acid secretion tests, and imaging studies such as CT scan or MRI to locate the gastrinoma. The treatment options include medical management with proton pump inhibitors (PPIs) to reduce gastric acid production and surgical removal of gastrinomas when feasible. So with this, we come to an end of the Season 1 of A to Z series. Thanks for watching and see you guys in the next season.